Now, South Africa is in the grip of a growing mental health crisis. Up to 92% of people living with mental illness never receive treatment, and that's leaving millions without the care that they need. Conditions such as depression, anxiety, and substance use are often untreated, whilst fewer than 1 in 10 people with severe mental illnesses access proper support. Today, psychiatrists from across the continent are gathering in East London, which is in South Africa, for the 2025 Congress of the South African Society of Psychiatrists, SASOP, under the theme Reimagining Mental Health Care Access. The meeting aims to confront the country's deep treatment gaps, share innovative solutions, and perhaps reimagine how care can be delivered at scale. Well, joining us this morning is Dr. Anusha Lashman, who's the President-elect of the South African Society of Psychiatrists. Thank you very much indeed for joining us, and welcome to the program.
Good morning. Thank you for having me.
Dr. Lashman, South Africa is facing what some have called a silent epidemic in terms of mental health care. What does it mean that up to 92% of people that need the help are just not getting access to treatment?
Thanks. It means that we have a crisis, and it's multiple reasons for that. One of the main reasons is that we don't recognize mental illness early enough. And when we do recognize it, we don't have opportunities to offer intervention and services. And the two big reasons that this is a problem on the continent, not just in South Africa, is that people aren't trained to be able to recognize it early. They aren't screened effectively. And when they are, there simply isn't an opportunity for them to access care, either because the facilities don't exist, or there are long waiting lists, or they're just not enough human resources to provide the kind of care that people require. And so what that does is it has a long-term impact on people's functional capacity, their ability to be constructive in terms of contributing to the GDP, to the economy, children who aren't able to function the way they should, parents who aren't able to parent the way they should in a safe way, because they aren't able to recognize and get treatment for that mental illness.
I suppose the problem is compounded in remote areas, the rural areas. If it's a problem in the urban areas, it's probably twice as bad out there.
Absolutely. And if you think about it, people access care close to where they are. When you think of limited resources, especially in provinces like the Eastern Cape, like in Limpopo, but even in densely populated provinces, if you think of Gauteng, sorry, in the Western Cape, we have fewer than half a psychiatrist for 100,000 people. One psychologist for 100,000 people. So that should just shock you into the reality of the fact that there just aren't enough people that are trained to provide that care. And perhaps this is what makes us really excited about having a meeting like this with thought leaders, but also in collaboration with partners that aren't just in mental health care services. So when we think of people who actually see our population, so traditional healers, educators, counselors, general health practitioners, this is the kind of engagement that we're looking forward to so that we can discuss opportunities for us to provide adequate mental health care that are integrated into services that already exist, even if they're scarce services.
You talk about mental health care practitioners. How do we compare to global standards in terms of numbers per, I don't know, 1,000, per 100,000, whichever vector you use?
Shockingly bad. So the World Health Organization gives us a benchmark of at least one psychiatrist per 100,000 in a limited income country or a low resource setting. We have a zero point 0.3
Wow.
basically figure of psychiatrists. If you want to imagine in South Africa stats for child psychiatrists, we have a population of 18 million children under the age of 18, and we have 35 child psychiatrists in the country. So children are never going to access mental health care, and the general population is just simply unable to find a practitioner to meet that need.
So what is the issue? Is it that not enough people want to train in mental health care, or that there are just not enough resources to train the many people that want to do it?
I think it's both. I think there's very little political willpower to invest in mental health care, support, and training. And here's the thing, mental health services do not need to be provided by specialists. It really is about upskilling, it's about integrating. You can't think about health without thinking about mental health. So the opportunity to train, to educate, to task shift, to upskill, that is not necessarily backed by the resources, both financially as well as infrastructure, to be able to facilitate that. So, yes, of course, there are people that want to learn, but there just aren't opportunities and facilities for that, and there's no investment in that.
So, SASOP 2025 begins, the Congress begins today in East London in the Eastern Cape. What are the main objectives of this particular gathering, and why is it significant that it's happening in the Eastern Cape?
I think that we want to recognize the fact that South Africa is more than just big cities that are well resourced. And the Eastern Cape is a really good example of that, where in a rural setting, people often have to travel almost 200, 300 kilometers to see a mental health care practitioner in a peri-urban area. So it's not ideal. So we chose this space because we think that this province really holds keys to solutions we may have for partnerships at a grassroots level. And so we want to engage in a discussion that involves thinkers from across the fields, traditional healers, as well as educators, counselors, healthcare providers that are at community levels in a very strong public mental health field, so that we're able to exchange ideas, but also come up with innovative ways of thinking around how we access care, but how we get to people who are stigmatized around mental health, so that we can reach the broader scope of the population, not just those in big cities.
So you're talking about reimagining innovative ways of access. What might that look like? Are we talking digital applications?
Thank you for asking that, because I think that we often think innovation equals tech. And that's not necessarily true. Yes, of course, we want to be able to access using online smart innovations like that. But sometimes it's also about education. So rethinking who should do what, whose job is it anyway? When somebody comes to you to the clinic for their cardiovascular disease, like they've got diabetes or hypertension, or they're coming to you because they have a cancer that needs treatment, why are we not screening for the obvious mental health associated factors there? If a child is coming to a well baby clinic, why aren't we screening? Is the mom okay? Do the parents have any psychiatric conditions that could be influencing the way they parent? So I think that the innovation has to really come from the way we think and the way we provide care in a different way, not necessarily tech, although that is part of it. And innovation is also about thinking around unusual partnerships. So being able to blend that in ways, and there are beautiful ways in which we can engage, and we know from the rest of Africa about community-based mental health initiatives, using lay counselors, using neighbors, using support systems that allow people to be mentally well and supported. So I think innovation is broader than just tech.
Dr. Lashman, I wish we could have talked for longer, but thank you so much indeed for joining us, and we wish you the best with the Congress. Perhaps we can catch up soon after just to get a sense of what came out of it. But for today, thank you so much indeed for joining us.
Thank you. It's a pleasure.
That was Dr. Anusha Lashman, who's the president-elect of the South African Society of Psychiatrists, speaking to us about the urgent need for health changes facing South Africa, and dare I say the continent at this time.